Does lens replacement treatment hurt? No, lens replacement treatment doesn't hurt. Lens replacement is essentially sophisticated cataract surgery. And during the procedure, the eye is completely numbed. It's numbed with drops and solutions of anesthetic, which completely anesthetize the eye. Patients may be aware at the beginning of the procedure when we drape the eye up, in other words, create a sterile field with a transparent drape over the eye, that's being applied to the eye. And we use a little blink stopper to keep the eyelids open, and patients may be aware of that being inserted, but apart from that, the procedure is painless. What patients are aware of is the microscope light, because we operate through a microscope, and of course to see what we're doing it needs some light. The light isn't very bright, but when it's first applied to the eye, patients can take a little time to adapt to that light. And then during the procedure, because lots of fluid is applied to the eye, what patients are aware of is the light and the fluid interacting, almost like a coloured waterfall or a kaleidoscope. So that's what patients are mainly aware of. We do have patients, more so in the refractive lens surgery group, who are younger than the cataract population, who feel very anxious. And in that group of patients, I will work with an anaesthetist who will provide some intravenous sedation. In other words, a very quick-acting Valium, which is injected into a vein, and the anaesthetist will monitor that so that the right amount of anesthetic sedation is applied, so the patient is aware what's going on, but not asleep, but not properly awake. And the beauty of it is, as soon as it's no longer administered, within 3 or 4 minutes, a patient's completely back to normal, as if they've not had any sedation. So these modern day fast-acting sedative drugs are phenomenally effective, and they almost switch on and off. The other advantage of them is that it gives patients amnesia, so that they can't remember the procedure. And also, the patients then have no idea of the time of the procedure. So for the anxious patients, and probably about 25% of my patients will have sedation. For the anxious patient, sedation's a good alternative, a good solution.